Hi, hello, welcome back. Let's discuss some interesting neuroradiology cases in this series. Will be very quick. Let's see the first case. This is 55-year-old male patient with vertigo, and this is the diffusion weighted MR image. What is the diagnosis? What are you seeing here? Yes, this is an infarct. This is right lateral medullary infarct, which is also called Wallenberg syndrome. Patient will have ataxia. He will have vertigo, and patient sometimes has other symptoms like dysphagia and all. This is secondary to M. pica territory infarct, also called lateral medullary syndrome. It is most probably an embolic etiology or a thrombosis which results in this type of infarct. Okay, let's go to the second case. Where is the location of this infarct? Where is the location of this infarct? Yes, who all have said it's medial midbrain infarct, also called oculomotor nerve nucleus infarct, also called Edinger-Westphal nucleus infarct. They both occur together. Patient will have severe ptosis, and he will have almost total ophthalmoplegia. So when will this occur? When there is an occlusion to the paramedian branches of the upper basilar artery and proximal posterior cerebral artery, you can have oculomotor nerve nucleus infarct. Okay, this is a relatively commoner infarct nowadays. You can see where is the infarct. The question is what artery would have been occluded. So this is a classical artery of Percheron infarct, or also bilateral medial thalamic or medial midbrain infarct, which occurs due to blockage of artery of Percheron, which is an anatomical variant which arises from the basilar artery. Instead of two paired arteries supplying the thalami, there will be a single unpaired artery which will be supplying bilateral medial thalami, resulting in this type of unusual infarct. Relatively rare, but we have to look for anatomy. Patient had seizures. What is the diagnosis? Yes, this is a case of left mesial temporal sclerosis. You can see definitely here there is increased signal in the hippocampus. At the same time, you can see there is volume loss, there is ipsilateral temporal horn dilatation. You can see slightly cornicial atrophy. If you see the hippocampal, parahippocampal gyrus, the volume is definitely decreased on this side. And you can also see in other sections where you have to look for the other ancillary findings also. So this is a case of left mesial temporal sclerosis. You should always look at other findings like mammillary body atrophy, cornicial atrophy, and other findings also. You should have look at it. Okay, what is the diagnosis? What is the sign? The sign here is there is tentorial enhancement, there is falcinal enhancement, and also there is enhancement of the pachymeninges over the temporoparietal regions. So this is a case of idiopathic, or this sign is called Eiffel Tower sign. You can see in variety of conditions like infection, carcinomatosis, meningeal carcinomatosis as in breast carcinoma, intracranial hypotension, postoperative states, idiopathic pachymeningitis can occur. CSVT, it will be there. Neurosarcoid, it will be there. What is the diagnosis? Yes, this is a case of persistent trigeminal artery, where MR angiogram is showing a hypertrophied artery which is supplying the posterior circulation. And you can also see the vertebrobasilar system is hypoplastic severely. And a sagittal MR, you can appreciate a tau sign. You can appreciate a tau sign in cases of persistent trigeminal artery. Fetal circulation gives this typical tau sign-like appearance. Okay, what are these abnormal hyperintense areas in the posterior fossa? These are Cadobes. These are cluster of arachnoid diverticuli in the occipital bone. It is mainly secondary to non-traumatic causes, or raised intracranial pressure is one hypothesis, or variable pressure situations is one hypothesis. We should know this condition very well to avoid the unnecessary biopsies. Let's come to the next case. There is a well-defined enhancing lesion in the lower CP angle at the level of jugular foramen, and the lesion is encasing the sigmoid sinus and part of transverse sinus, indenting on the cerebellar parenchyma. And there is intense increase in the perfusion, or there is high perfusion values within the tumor. What is your diagnosis? The differential diagnosis for these lesions are either schwannoma or a jugular, glomus jugular, or a glomus jugular. One will have less perfusion, one will have high perfusion. In our case, the glomus jugular has high perfusion, also called paraganglioma. There will be destruction of bones, and CT, complementary CT, will tell you the extension of the disease. Especially contrast enhancement, intense contrast enhancement with high perfusion values is more in favor of glomus jugular. Okay, this patient had SAH. What is the CT angiogram image showing? CT angiogram image is showing a sacral outpoaching, which is seen in the ACOM. So this is a case of ACOM aneurysm, the cerebral aneurysm that occurs in the anterior communicating artery. ACOM aneurysm appears as a focal dilatation or outpoaching, giving a typical sacral shape. CT angiography, you should be careful. You should look at the fissures grading, intrahemispheric blood. Whenever there is intrahemispheric blood, and when there is non-traumatic causes, you should always look for ACOM aneurysm. So coming to the last case, this patient had a trivial trauma during toddler age, and at around 11 years, he is presented with a cystic lesion, which is palpable in the parieto-occipital region. What is the diagnosis? So this is here, what you are seeing is a classical growing fracture. So this is a growing fracture where there is a clear gap of the bone fragments. So both the bone fragments are displaced to the other side, and there is enlargement of neuroparenchyma. You can, though this is not the window, you can appreciate some amount of gliosis. This type of appearance is called growing fracture. So you can also see butterfly appearance at the fracture site. You should all know about this condition to avoid unnecessary biopsy. Thank you very much. Hope this video on Neurorad spotters was useful for you.